A few years ago, a 31-year-old doctor was found dead in her car at a hospital parking lot. The tragedy her family attributed to severe fatigue from punishing 30-hour shifts. And this year, on March 2026, a similar incident happened. The endless chronic exhaustion is costing lives now. Have you ever wondered who takes care of our healthcare workers when they finally break down? My name is Zulkifli Bin Yaacob, and I am an occupational therapist with 14 years of experience. At the moment, I am working in Hospital Putrajaya. Being a therapist and as a patient myself, I have seen and experienced the devastating toll that chronic overworks takes on our clinical staff, which leads to severe fatigue and burnout. According to Malaysia's Health Human Resource Statistics, our public healthcare is bleeding talent. There is a critical shortage of 8,000 nurses. From 2019 to 2023, over 6,400 medical officers and 1,000 specialists resigned from public service. The remaining staff are facing the issue of long working hours and serious risk of mental and physical stress. We cannot fix the staff shortage overnight, but we can fix how we support those who stay. That is why I am proposing DecomCare, a psychological treatment backed by cognitive behavioral approach. It is an on-site burnout prevention service. It provides burnout first aid training and 24-hour access to occupational therapy curated micro sanctuaries, which offers instant psychological relief and decompresses sensory overload. Many research suggests that CBA leads to significant improvement and function in quality of life. In many studies, CBA has been demonstrated to be as effective as or more effective than other forms of psychological therapy, psychiatric medications. The medical staff have to endure rapid shifting focus from one patient to another. While physically and mentally exhausted, they make highly crucial life and death decisions. The open loop will drain their brain energy and cause emotional breakdown. When clinicians are worn out, their concentration fluctuates and it will jeopardize the patient's safety. The main issue is the high ratio of patient to staff. During off-peak hours, a nurse may have to care for 10 to 15 patients, especially during night shifts. In contrast, international standards have suggested a better ratio of one nurse for every 4 patients. The Ministry of Health reports that symptoms like extreme irritability and tiredness indicate staff are suffering from severe burnout. Here comes a solution to the rescue: DecomCare. DecomCare provides a practical, immediate solution to the struggling staff. Unlike generic wellness apps, DecomCare brings the intervention directly to the staff. DecomCare equips hospital staff with 1-hour burnout first aid training. It also establishes a 24-hour full access to occupational therapy curated micro sanctuaries right in the hospital. It offers immediate mid-shift or post-shift nervous system regulation. This also works as a shutdown rituals to disengage from the work environment and transition to the peacefully to go home to be with family. First, 1-hour burnout first aid, which can be split into 2 separate micro sessions during office hours. It drills on functional nervous system regulation techniques. Second, we build DecomCare micro sanctuaries by transforming underutilized hospital rooms into occupational therapy approved safe spaces. The room has deep pressure seating and sensory decompression tools. Any healthcare workers can step off from the chaotic environment and retreat for just 10 minutes to instantly decompress the stress and re-energize. The solution is highly necessary and greatly effective. Zero leave required. Because these micro sessions are integrated into existing shifts, hospital management does not need to arrange costly locums to prioritize staff mental health. Immediate on-shift relief. The micro sanctuaries provide a tangible space to manage emotions positively and do relaxation techniques as recommended by the Ministry of Health for overcoming burnout. Clinically proven ROI. We know this works. A recent peer-reviewed study at Hospital Tunku Fauzia proved that implementing a primary psychological intervention significantly reduced emotional exhaustion and depersonalization among emergency staff. DecomCare is not just a perk, it is a game changer for hospital environment. By seamlessly combining OT-led burnout first aid with accessible on-site sanctuaries, it empowers our medical professionals to sustainably manage their stress and continue with their vital work. It is time to protect the frontliners heroes who protect us every single day. Don't let our healthcare system collapse from the inside out. Approve this service. Let's build a foundation to reach for a healthier healthcare system with DecomCare today.